Okay, my name's Sharon Kirkendall, and I'm your wellness coach. I'm here every Wednesday, and today I'm going to be talking about knowing your numbers. It's all not cut and dry, black and white. So hopefully from today you'll learn that the importance of foods and activity and how that impacts your labs and your biometrics. Also, when we would send you, because of your labs or biometrics, to follow up with your primary care doctor, in what time frame, and also those critical values of when it needs to be even a faster follow-up with your doctor. So the ranges I cover today are going to be based on your program, your wellness program. It might vary a little bit from other sources. Sorry. Okay. So the first thing of what we get is your total cholesterol. Total cholesterol is your HDLs, your LDLs, and a fifth of your triglycerides added together. So it is not the most important number, it's the least important number of all of them, because it's those other numbers that we're going to look at. In a person that has an average total cholesterol, that would be less than 200, 75% is made in your liver. The rest comes from the foods we eat. There's also a genetic factor in there that has to be addressed individually. It's a controllable risk factor for your heart, cardiovascular prevention, preventing strokes, preventing the heart attacks. And this just shows you a picture of the cholesterol and trying to get you the triglycerides, HDL and the LDL. So cholesterol is a fat, soft substance. It's in the bloodstream. It also is in all your body cells. It's necessary for your body to function properly. It's also in some hormones. It forms your cell membranes. It's very much necessary, but too much is a problem. And then the levels there, the one that you guys need to know is we want it less than 200. The other numbers are when there's some risk involved, moderate to severe, and those are when we would send you, either tell you to go follow up with the doctor within, say, 60 days or 90 days, or sooner, depending on the numbers. So triglycerides are the most prolific fats in your bloodstream. They circulate in high numbers. It increases your risk of heart disease and metabolic syndrome. So some of the things that put you at risk for having high triglycerides is having a BMI greater than or equal to 30, having diabetes that isn't well controlled, having kidney disease, having problems with the thyroid that is underactive, hypothyroidism, drinking a lot of alcohol, certain medications, too large meals, and it can run in families. And the next slide will show you the xanthemus, which is a skin kind of texture that comes on people that have high triglycerides. Usually it shows up later in life. And I don't know if you can see, but right here it's kind of a patchy, kind of scaly, fatty looking skin. And that's, I don't know if it's very visible to you, but that is definitely right in here.
It's kind of dry and patchy, dry at times too, and it's scaly.
It's kind of looks like it's got little fat globules, but real small, little raised, waxy, shiny little areas. So if you there by, triglycerides are increased by eating saturated fats and by eating simple carbohydrates. You can lower these by decreasing those, the saturated fats and the simple carbs, simple sugars in the diet. You can also lower them by eating the oily fish, the salmon, mackerel, tuna, sardines, trout. Also eating walnuts, ground flaxseed, and activity. So cardio activity is going to help improve those numbers. It's going to burn up some of those extra calories. Diabetics usually have high triglycerides. They go hand in hand because of the extra sugar that's floating around in the bloodstream. If your triglycerides get to be over 400, you can't calculate the LDL. It's not considered accurate. So you don't know what your LDL is doing when your triglycerides get over 400. We want those less than 150. And then 150 to 199 is your borderline, and then above 200 is when you're at risk. So the low density lipoproteins, people have troubles remembering which one's happy, which one's sad, which one's bad and good. So I like to call them the lousy lethal guys. These are the ones that put plaque in the artery walls. They clog the artery walls, they get into the wall of the artery. So some people think it's building up on one side, but if you think about it, it's starting to get into the cell walls, it's building it up. It looks kind of like a, should be another picture on there. I'm going to click again and see if I made it right. Nope, you can go back. Sorry. Somewhere my guys, I misplaced. So this one anyway, sorry. He gets in the cell walls, so think about your water pipes in your house as they get older, and if you ever cut them open, it starts getting those deposits build up, and that happens over time with the LDL. So LDL levels can be varied according to your history. So I can sit there and say, hey, we want your LDL levels to be less than 130, but if you have diabetes or heart disease or you have high blood pressure, then it's going to be what your doctor recommends. It's going to probably be even lower. So in some of the medical conditions I've told you about, the heart disease, diabetes, vascular disease, inflammatory diseases, those can also cause it to the doctor to want it to be lower. And then that's some examples of saturated fats and trans fats that might raise your LDLs. They're hidden. So you guys, I think all three of you have attended Sally's talk about the trans fats and the saturated fats. Of it saying partially hydrogenated or hydrogenated on the label, that's a trans fat. And then saturated fats are just about everything we eat. It's just you want to get the smallest amount you can and get more of those poly and monounsaturated fats. And I know I should have left peanut butter there, but there are brands of peanut butter that you can get that don't have trans fats in them. So foods that are proven to lower your LDLs. That would be oats, beans, legumes, peas, apples, citrus fruits. And like I said a little bit earlier, that they want this less than 130. So that would be the ideal. So H is happy. This is how I remember them. H is happy, healthy, you want it high. The higher the better. It's the one that can be protective. If you can get that one above 60, it's so protective for you that it goes around like the Pac-Man or the trash men, and it picks up the LDL, takes it back out of the bloodstream to get it back to the liver and out of the system. So it's not there to get in the cell walls and clog the arteries. You want that one to be above 60 is where it's protecting. If it's less than 40, you're at risk. So the double whammy here is the trans fats, they push your HDL down and they raise your LDLs. So that's why they're considered really bad. Aerobic activity is also the only way that you get your HDLs up. There's no other way to raise them besides aerobic activity. I think that's it. So also, there's no food out there that raises those HDLs. So it's the activity. And then your HDL ratio to your total, that's an important number too. You don't want your good guys outnumbered. So looking at that ratio, it's how many HDLs do you have with your total cholesterol? So you want more of the good guys than the bad guys. You want that to be, the ratio to be less than 3.6. And there's an example up there that if your total cholesterol is 200 and your HDLs are 50, then your ratio is 4 to 1. And that wouldn't be right where you want it. You want to be even lower on the ratio. So your hemoglobin A1C, that's another one that we screen for. That's your average blood sugar over the past 2 to 3 months. Want that one to be less than 5.7. So non-diabetics, you want that level to be less than or equal to 5.6. And then diabetic levels, they want that, most of the time they want that less than 6, but that's also up to your doctor. Some doctors are happy with it less than 7. And if you don't know what this is, it's red blood cells. The hemoglobin has, and the sugar has an affinity to get onto the red blood cells. And so what they're measuring is the thickness of that sugar on the red blood cells. Red blood cells have a known life. And so by measuring the thickness, the thicker that level is, the higher your A1C. So that's how they look at the average. Tell what you do most of the time as far as the eating goes. There's also the fasting blood glucose. So blood sugar tests, they're going to measure, we stick your finger, we check your blood sugar. It's going to tell us the amount of circulating sugar in your blood right at that moment. So if you're doing it fasting, you should have it less than 100. You should actually, 70 to 99 is what's considered normal. It can change with your activity. It can change with what you eat. So if I eat a meal that has a lot of simple carbs and has very little protein, my sugar at that time is going to be higher. And so your A1C is being the average of what you're doing, where the actual blood sugar is looking at, hey, what is it right this minute? It's a shorter term look. But it's also used they use it a lot to help diabetics learn what this meal is doing to them. It's also a good screening tool for blood sugars. So your random test on your blood sugars, you want those less than 80. That means, hey, you ate. And so you want it 80 to 139 if you ate a meal, and then got to check. So blood pressure. What that is when your heart, it's a force against the blood vessels. So when your heart pumps, the systolic number is when your heart pumps, it's pushing that blood out. It's how hard your heart is having to pump. And then when the diastolic is the resting part, so as the blood is filling up into the heart, that's where you get your bottom number. They want that to be less than 120 over 80. That's the goal. It has to rest between beats. If it's not getting that resting, it's having to keep too much pressure there, that's going to cause problems. If it's having to push too hard, different things can cause it to have to push hard, such as coronary artery disease, plaque buildup, hardening of the arteries will cause that, to have to push harder to get it out there. So if you would think also about your plumbing at home, and you turn the water on, and it's coming out really good. You've lived there for 70 years, and now you turn the water on and it's coming out as a little trickle. It would have to take a lot more force to get it out now because of the buildup. So I was kind of talking about this, so that's when it pumps the blood to the body, you want it less than 120 or less than or equal to 119. It's considered normal. American Heart Guidelines, 120 to 139 is considered pre-hypertension. 140 to 159 is stage 1 hypertension, and stage 2 is anything over 150. So they look at these separate and they look at it together. When your heart rests in between beats and gets that diastolic, you want that one less than or equal to 79. You want it to, that would be your normal. 80 to 89. Did I say that right? No. Yeah. 80 to 89 is going to be pre-hypertension, and then 90 to 99 is stage 1, and then above the 91 or 99 is going to be your stage 2 hypertension. So one blood pressure, though, doesn't mean much. You need a series of them. So I want to make sure you guys know that. Your body reacts to stress by fight or flight, increases your pulse, increases your heart rate, dilates your eyes, increases your respirations, so you can run away. So if you have a saber-toothed tiger in front of you, it makes your blood pressure go up because you don't want to be eaten. And you either have to fight or run away. Now, if you can calm yourself, bring it down, have a normal situation, the stress goes away, then you're going to have a better blood pressure. So some people do have white coat syndrome, and that would be a candidate for having a monitor at home that they can feed that information to their doctor. There's other things that can play in there, but that would be a good thing to do, is if your blood pressure's running a border, is to just monitor it more frequently so that you can sit there and take that to the doctor so they have a bigger picture of what's really going on. We take a waist measurement on both men and women. We want the men's waist. There's a correlation between waist size and heart disease risk. We want the men's waist size to be less than 40 inches. And if you click it again, it should bring up our females. And the females, we want their waist to be less than 35 inches. Otherwise, it increases the risk for heart disease and diabetes for both the men and the women. So it's measured on your women's natural waist. It's measured on men's belly button. They're pretty close to the same. And the height you take, that is just a vertical distance from where your feet and your head. So you do get gets shorter as we age, and none of us like to, and and yeah, hopefully it's very gradually, but the discs become thinner. There's moisture that's lost in the disc between the vertebrae, and so as that happens, you kind of lose that height, and you can do things to stand up straight and tall, but it is going to happen to all of us.
That's just an average person kind of lose like twice.
That depends on the
I
person.
mean, are we talking
So-
a couple inches or are we talking?
So some people will lose a quarter to a half inch a year as they get older.
A year.
A year as they get older. Some it's much slower than that. It could be that for 10 years they lost a half inch. But I know people that have lost an inch or more in a year. But there's some degeneration that's going on with the bone too. So each person, I can tell you by race, there's a difference. The difference is people of color have thicker, stronger bones, and they will not lose the height as a Caucasian. So they can still lose it, but usually not as quick. The difference sometimes is you go to the doctor's office, and anymore they don't ask you to take your shoes off, but we do. So you have to take that to account too. And if you know what you used to be as far as your height goes, you can always say, wait a second, that doesn't sound right, measure me again. But I keep saying I'm taller than I am because, none of us want to lose that height. So I don't know how fast I've lost it, but I've lost it, and I'm not happy about it either. Weight is just total body mass, so that includes bone and tissue and the fluid volume that we have. In a healthy range, your blood circulates more efficiently. The fluid levels are easier to manage. And people are less likely to develop diabetes, sleep apnea, heart disease, certain cancers go along with the weights. And so BMI is a height-weight ratio. It's calculated, it's based on it's based on the high schoolers a long time ago where they were considered the optimum health, that height-weight ratio. This was when they were at the peak of their health, when all of us were probably at the peak of our health was in high school. Not necessarily true for all of us, but most of us. So that scale came out during that time. And it still holds true to say, hey, that's still probably your healthiest weight. Does that mean that's where we want to be? Not necessarily. I certainly don't want to be back there to my high school weight, So we have to find where we're comfortable and where we feel our healthiest to be. It's just a way to screen, to say, hey, these people are at risk for these diseases. That's it. So the ideal, and people can be underweight and be at risk, and people can be overweight and be at risk. So there's serious issues on both sides.
What is in kilograms? What's that in?
That's the calculation. That's kilograms per. That one here is 18.4 to. So it's about 18 to 24.9 is pretty much in the normal range for people.
Is that like pounds? Does that represent pounds?
So it gets converted. So when you go into your portal, if you want to see where you are, go to your screening results, and it will tell you where you're at. It's based on that height, weight, its ratio. Or you can stop down at the room I'm at, and I can pull out a little sheet that's already got it pre-calculated and still do the math for you. But it's out there, been there forever. I'm not sure what year it was came out, but probably back in the 40s or 50s, somewhere in there. Yeah. So we also do a body fat, because not BMI doesn't work for everybody. So body fat is, we put in there your height, your weight, your age, and whether you're male or female. It puts an electrical current through you. It's contraindicated if you have any implanted devices or if you're pregnant. And what it does is this electrical current, you connect the current, you complete that circuit, and it measures resistance. So fat, muscle, water all have different resistance, and then it comes back with the body fat. So a bodybuilder, if you looked at the BMI, they'd be out of range. Somebody that exercises a huge amount is going to be out of range, but their body fat might be in range. And people that are my size or littler could look like, oh gosh, you know, they don't have much fat on it, but if you do a body fat on them, if they're not exercising, they're going to have a high body fat. So for men, we want them to be 6 to 18, and for women, we want the number to be 12 to 25 to be considered normal. They have scales that you stand on at home now that do that too. So your basal energy expenditure is something that we come and give you. What that is, it's the amount of calories that's required for your body to function. To keep your heart beating, to keep your lungs breathing, to keep your temperature regulated, to make sure all your vital organs and systems are functioning. So when you eat your calories during the day, to digest that food and everything else, when you're laying in bed doing absolutely nothing, that's what it takes to keep you alive. Even when you get out of bed, you still have those body functions going on. So it takes a large portion of your calories to keep you alive. And that's how you base that with BEE. You can base that on how many more calories you need for the activity that you're doing. So we're going to get to the critical values. I'll try to do that real quick. Critical values are based on the numbers that our healthcare provider gives us for the program, where he wants follow-up with the doctors. So with your triglycerides, if they're over 500, equal to or over 500, we're going to send you to your doctor within 7 days. If they're 300 to 499, we're going to send you in 30 days. And if they're 150 to 299, we're going to send you in 90 days. When they get up there at 500, if you think about Crisco running through your blood, that's what it kind of looks like. If you would take your blood and spin it and separate it, the serum looks like really thick, yellow, thick. The closest thing is to think of a Crisco that's kind of on the watery, looser side. But that's what it looks like. So your LDL, there's in here it's divided up for diabetics and non-diabetics on our guidelines for when to send you to your doctor. If you're non-diabetic and your LDL is greater than 130 or equal to it, we'll send you to your doctor within 90 days. If you're don't have any heart disease, because heart disease plays a role also in us sending you to your doctor. If you have a history of heart disease, if it's 130 or greater, we're going to send you to the doctor within 90 days. If you're diabetic, we're going to send you there if it's over 100. And I told you earlier on LDL that it can be different for people with diabetes, heart disease. And then here, again, with any cardiovascular history, we'll send you to the doctor if it's over 100 within the 90 days. A1C, good indicator on that insulin resistance. So if you're not diabetic and it's greater than 10, we're going to want you to follow up with calling the doctor while you're in the room with us. And we want you to follow up with 1 to 2 days. If it's 8 to 9.9, we're going to have you follow up within 30 days. And it's 6.5 to 7.9 on your A1C, we want to follow up in 60 days. Make sure your doctor's aware and that they know what's going on with you, and then they make the ultimate decision on how they want you to go with your treatments. If you're diabetic and it's greater than 10, same thing. We're going to have you call right there with us and then go within 1 to 2 days. If it's, I gave you a wrong number there. Type 2, if it's greater than 10, you're going to follow up within 7 days. And if it's 8 to 9.9, you're going to follow up within 60 days. And 7 to 7.9, you follow up in 90 days. So again, here we go with the diabetes, looking at blood glucose levels. Non-diabetic, if you're over 300, we're also going to have you call and go in as soon as possible. If you're type 1 diabetic and you're over 300 or equal to it, we're going to have you go in as soon as possible also. If you're the non-diabetic, you're going to go in within 7 days if it's 126 to 299. And 100 to 125 within 30 days. The type 2 diabetic that's over 300, they got 7 days. And then type 1 or 2 at 200 to 299 within 30 days. So going in sooner is definitely important, the higher that number. So if your systolic blood pressure is over 180, we're going to have you go to the doctor within 7 days, and we're going to call your doctor while you're there with us. And if it's over 110, for your diastolic range, we'll also have you call there and follow up within 7 days. So the 30 days follow-up, if it's greater than 160 over 79, and 100 over 109 on the diastolic side. And the last one for the 60-day follow-up is if it's over 140 over 159, or if it's 90 over 99. That's a 60-day follow-up. So references are for American Heart, American Diabetes. What the shared drive is our doctor's orders for when you will have those critical follow-ups. And then in your Dunwell portal, you can go in there and you can find those resources. So So the foods I talked about, I gave you a handout. I know it's small print. If you can't read it, you can go into the health library and it'll give it to you. And then the others were just going in and looking, making sure all of my numbers match yours. So, questions?
I typically have a low blood pressure, but I have high cholesterol. Where does
Yeah.
that fit in? Because I'll have my blood pressure, and this varies, but I've had like 104/71.
Which is still considered a normal.
Yeah, but the cholesterol is high. You would think that my blood pressure would go higher with my cholesterol being high.
So eventually it can, but the cholesterol is more likely, it's not, so your blood pressure is salt affects it. And then the foods that you eat affect your cholesterol. Genetics affect it, but blood pressure can be affected by other things too. It can be affected by liver function, kidney function. So they're separate entities. You gotta kind of treat them separate and say, which one is it that's most important for me to address? But your 104/70 is not considered low. It's considered normal. It would be less than 90, less than 60, back down in there, way low. And if it's symptomatic, it's a problem, but if it's not symptomatic, it's not an issue. So it's probably more that you run on the normal side, and it's still the cholesterol that would be addressed. Do I have anybody else questions? So we can talk more about that later.